So what drives healthcare costs? We can all debate on the percentages, but I think in a simple HR brain like mine, this is how I look at healthcare costs. If you look at how much money you spend on a personal level, I think 50% of your cost is driven by your own behavior. And 20% is going to be driven by your access to healthcare. 20% is probably driven by the environment you live in, and 10% on genetics. Now again, we can all debate on the percentage of that, but I think that's a fair high-level representation. So as an HR guy, I'm thinking, okay, if I'm going to have a healthcare strategy, I can't affect the environment, I can't affect your genetics, but you know what? I can play a role in your behavior and even access to healthcare. So when we started the journey of let's create a healthcare strategy, the first thing we had to do is make sure that it really is aligned to your human capital strategy. A lot of employers, I've seen a lot of my peers just do the healthcare strategy in a vacuum, and you really got to tie it to what is first your overarching healthcare strategy. Second of all, when we built the strategy, we built components that we've never had before. It had to have accountability on both sides, both us as an employer and employees. We had to make sure we had employee choice. I learned from the HMO days, one size fits all doesn't work. So I wanted to make sure I had a lot of offerings and different ways of affecting people's behavior and access to healthcare. Benefits literacy is absolutely critical. It's kind of hard to tell people to be accountable to something if they don't understand it themselves, if they don't understand what tools are out there to help them to modify their behavior. Clearly program improvements, regulatory compliance, and I can't stress this enough, company leadership. We have to figure out a way to get all levels of the leadership in your company engaged in this discussion as it relates to how they relate to their own employees. That the healthcare industry that provided the delivery mechanism is not going to be the panacea. We get so focused, I think, in this country that, everyone's using the analogy of cars. You blow your engine, we're fixated on which one is the best mechanic to fix it, who has the highest quality, are they convenient, we do it. You know what, if you just change your oil every 6,000 miles, you wouldn't have a blown engine. So I think we got to get the fixation on us as individuals, on the accountability, and now how as an employer can you help that? I think that's what I've learned in the last couple of years.
Thanks, Bill.